Hi, good morning, good afternoon. Welcome to another edition of Metabolic Wellbeing Without the BS. I'm your host, Martin Gillespie, and we have gone to the other side of the world today for a wee cracker. Somebody who can understand Scottish accents, as she is a Kiwi, which is New Zealanders, for those who don't understand Kiwi, but based in the beautiful city of Adelaide. Sarah Hancock, welcome to the show.
Thank you, Martin. It's great to be here.
Sarah, I've got a question for you. What does metabolic health feel like for you on this day?
Probably what it feels most like is, if we think of well-being as feeling good and functioning well, I think it's a state of well-being in which, well, we've got some, some fairly objective markers of metabolic well-being. But I think it's having various pillars of health lined up, whether it's, your nutrition going well, your exercise going well, sleep and rest going well, your engagement with other people and your relationships going well. And all those things mean that you can, I guess, swing a bat at life and, focus on the things that you want to do in this life within the community in which you work and live. And so I've always thought, or I heard something recently, that the people who are unhealthy have one dream, and that's to be healthy. Whereas the people who are healthy, they have 1,000 dreams and they can go about achieving those. And I think that's a really good way to think about metabolic health and well-being. And that, we're living through a time where, there's so much poor metabolic health being experienced, unfortunately, by so many people on this planet today. And it's having a huge impact with regard to public and private costs, and impact on, individuals, families, communities, and society at large. Yeah, for sure. So, so metabolic well-being, but ultimately feeling healthy so that you can get on and do those things that you want to do without feeling too tired, without feeling too sad, without having any experiencing physical pain associated with poor health. And so, there are ways of fostering that through nutrition, sleep, exercise, your relationships, maintaining your physical and brain health, and doing some hard stuff to adapt and become stronger. And if you're experiencing problems with metabolic health, it's really difficult to do that hard stuff, to challenge yourself and adapt and get better and stronger.
So many elements there, Sarah. I want to take the phrase that you've said, pillars of health, and expand on it. Now,
Okay.
for the listeners, can you explain a little bit about the work that you've been doing over the last couple of years? Because that's a great segue. You've been specialized in, and you've got a PhD in oral health, effectively. Is that correct?
Yeah, basically, the PhD's in the field called public health nutrition. And I took a focus on child oral health. I'd been interested in various, diets, eating patterns, dietary lifestyles. It's probably an interest or an awareness that started off quite early in my life, actually, when my sister was diagnosed with type 1 diabetes when I was 10 years old and she was 8. And, so I had a ringside seat to that sort of level of monitoring of food, and had very early appreciation for how, what she ate or didn't eat, or how she exercised or didn't exercise, had a fairly large impact on her health, and that she could be, get very, very sick very, very quickly and be fine. But diabetes was kind of like an unwanted child, sort of come to join the family, and it was always there. And then, became more interested, did a phys ed degree because we were all, told that exercise was the main linchpin around which you can, protect and enhance your health. And so, it's sort of been a journey from there. So I've got a PhD in the whole oral health thing because I got very interested, as time went on, and did a master's in health technology assessment, got back to New Zealand about 20 years ago. And there are a lot of people getting becoming diagnosed with type 2 diabetes and requiring medication for it. Now, on the day that my sister was diagnosed, we had to go and stay with my grandparents, and I didn't know anything about the diabetes apart from the fact that she was going to need to have injections all her life of insulin at that point. And so we went out to the garage, my grandmother and I, dug out her encyclopedia on, D for diabetes. In fact, her one was printed in 1941. And it was something she bought when, her first child was born. Most people buy practical things. She went and bought encyclopedias. And it went into the fact that, insulin was a really great thing. It was a lifesaver for the people with type 1 diabetes. But there was this other quite rare form of diabetes that basically was caused by, your inability to metabolize carbohydrates. And that here's the solution. You can eat bacon and eggs and not flour or sugar or that sort of thing. And I can remember thinking, well, that's really unfair that if she had to have diabetes, she didn't get that one because that would be just easy to deal with rather than having to have injections and monitor what you ate on an hourly and daily basis and how you felt and all the rest of it. So yes, so that's an issue. Yes, and then my daughter was diagnosed with non-gluten or non-celiac gluten sensitivity. So back and she was about 4 when that happened. She's now 18 and flourishing, doing really, really well. So became more and more interested in the whole diet, child health space, and then there was the opportunity to do some postgraduate research when my children entered high school. And then we just, then developed some questions around the oral health and the fact that, it's the most chronic or it's the most common cause of hospitalisation in New Zealand children is the removal of a tooth. 29,000 kids in New Zealand under the age of 14 lose a tooth each year through decay. And several thousand of those kids are preschoolers who are having multiple teeth removed under general anaesthetic.
So hold on a second here. You've said a couple of stats here. We're talking presenting at hospitals with tooth decay symptoms.
Yes. Yeah. With multiple rotten teeth.
So what age group are we talking about here, Sarah?
We're talking about the under 5s who are, entirely dependent on what other people are providing for them. Yeah.
Under 5s presenting with?
Under 5s, several thousand under 5s are being operated on every working day in New Zealand. That sort of comes at a cost of about more than $130,000 per day in New Zealand to the public health system.
Wow. That's millions of dollars a year.
Yeah. Yeah. We'll get up tomorrow and do that on Monday, and then we'll do it on Tuesday. And and there seems to be so much indifference about it, like anytime it appears on TV, it's like, oh, that's really bad. And then, various commentators say, well, parents just have to feed their kids better. But, there's the food environment and there's all sorts of other challenges to, eating healthily and well, some of which I explored in my PhD, that actually make that really quite difficult.
So one of the massive categories, for example, that has exploded in the modern world is that of baby food.
Yeah.
Now, even 20 years ago, there was a very, very small shelf in most supermarkets with a line of baby food. Now it's almost half an aisle, if that makes sense.
Yes. Yeah.
What's your experience and knowledge about the impact of these food-like products on such small human beings?
Yeah, I think the sugary drinks are a problem for small human beings. There's a lot of these very highly processed foods. Now, my oldest child was actually born in England, just in 2003. And when we moved back to New Zealand when she was only a few months old, I had, just got a jar of stuff that we could just feed her on the plane. But anyway, opened it up when we sort of thought, we'll just try this. Opened it up when we got back to where we were living. And it smelled terrible. And you looked at the back of the little jar that it was on. It was this banana custard. And I sort of thought, oh, that might be nicest for something after dinner, but it smelled terrible. And only 2% of what was in that jar was banana. And the rest of the ingredients were all a bunch of things that you couldn't pronounce or various additives. And I sort of thought, well, what are we doing eating like this? And so anyway, I threw that out and just went back to still thinking I'll just fill up all the wee bottles of food that I'd cooked at home and put through the blender and frozen, and just bring that out and we'll just continue eating as normal. So we never fed the kids, or we never fed our daughters any food like that. Because I was very, very lucky. I was in a position to be able to, spend that time preparing all their food. And that's not the case for a lot of families out there today, where the healthiest choice is not the easiest choice. And, family life is hugely different from when probably I was growing up, when our parents were growing up, Martin. And yeah, and I think that's difficult, and we don't know, the effects that, these highly processed foods are having on small children. But with there's very well established relationship between a high sugar intake and poor oral health. But we've one of the studies from a PhD, I did a systematic review on the impact of the sugar and starch containing foods, which are not necessarily sweet, but they consumed as snacks, are associated with increased dental problems in children.
So, so many areas here rattling through my brain here. We're not just looking at the impact of their teeth. If we're feeding young human beings poor food choices, it's going to have a massive impact on their jaw structure and their whole human being, because they're not going to digest proper food and their muscles aren't going to grow properly. Saliva is not going to be properly developed. This is a global pandemic.
Yeah, it is. And I think a lot of these foods are quite soft and easy to chew. And so there's just not the development of the jaw to the extent that it should be because of these foods. But what's a bigger problem is that, and I can remember chatting to, she's a first cousin once removed actually, and New Zealand's first female professor of pediatric dentistry. It's Professor Bernadette Drummond, and she told me that what happens is when these kids get decay very, very young, like say before the age of 2, which is just tragic anyway, they don't have the language skills to communicate that their mother's sore. So they become fussy eaters because they can't actually chew the food that they want to chew. And so families get a bit desperate. They think the child's not eating enough. It's difficult to get any food into them. And so they get into this habit of grazing on ultra-processed snack foods as well, whether it's your little wee shapes crackers and all the rest of it, because they're just desperate to see the kids eat something. So then what happens is there's a cycle of continual grazing on foods that break down very easily in the mouth, that are really highly, refined carbohydrates. So they're things with healthy food labels on them and regarded as healthy snacks because they don't have saturated fat. But there's quite a lot of processed carbohydrate and other stuff and flavors and emulsifiers. But the starches actually hold the sugars in the mouth for so much longer, because there have been studies done where we have longer emptying times of the sugars from the mouth when they're consumed as processed starches, which is really interesting. We're not talking about like boiled potatoes here. We're talking about your Pringles and your crumpets and your breads and your muffins and your muesli bars and, those things that might not necessarily be overtly sweet, but they do have an impact as well too. My battery's actually, we'll just do a pause here because my battery's actually running low. I'm just going to go and grab a cord.
Sarah, I have a massive question there around the grazing and toddlers, if that makes sense, that don't have the verbal skills. I see this a lot, that, if you take a year before that, when the teeth are coming through, the growth that a lot of parents don't know what they're doing, and then they'll do something like putting Bonjela into their mouth or a painkiller, if that makes sense. Is there any evidence around the impact that has on their oral health?
I'm not really aware of the impact of Bonjela or the painkiller on the development of the tooth, but if these kids, have a problem, problems with enamel formation, and that can be the case if vitamin D is low in their mothers during the gestational period. We do know from, there's some associations between low vitamin D status and increased caries burdens in their children, after they're born because of problems with enamel development because of insufficient vitamin D and vitamin K2, because, much of the tooth development happens pre-birth, because the odontoblasts that are produced in the bone marrow, or that start off as stem cells, are actually really important in the development of the enamel and the dentin, which is the layer underneath the tooth, underneath the enamel of the tooth. And so what happens if you've got these kids whose teeth are already compromised and they're given a sugary drink or, sugary foods very early in the piece, and then they get into a habit, and develop some early decay, which will cause pain. And therefore, they can't tell anyone that their mouth is sore. It's just something they're just living with all the time, but it makes chewing difficult. And so there's just like a cycle continues of grazing and on, foods that are easy to chew and swallow so that it's not going to be so painful for that child. And so they might grow up having a diet of predominantly very, very soft foods, because actually eating an apple or carrots or chewing through meat is actually just too difficult and it's too painful.
Really interesting
Which
aspect.
is,
I want to ask you there
yeah,
around what's the alternatives then? Because you mentioned it, the healthiest choice for newborn parents, maybe that's not the right thing, first-time parents. There's so much information out there.
yeah,
Nothing, you don't know anything until you bring that baby home from the hospital and it's 6 months, pardon me, 6 months old and a year old and it's crying. And what are some of the nuances that people could do to help their child develop the oral health?
as far as the most important thing they can do is not feed their children sugary drinks and the refined carbohydrates, and to, where possible, in the same way that you do all the way through the life course, is to cook and prepare foods the same way you ideally would yourself from unprocessed food sources. Like, introduce meat at, when they're a few months old, by the time their kidneys have developed enough to be able to process that. But actually some of that baby rice that is often fed to children, well, there's no nutritional benefit really to that. And plus it's revolting. And some of those rusks that they give kids, for teething, that's just essentially the ultra processed food. So I think probably the most important thing to do is to, there's all sorts of reasons that people can breastfeed or not breastfeed, but also don't have a baby going to sleep drinking milk, because that does have an impact as well too, especially on the early caries formation. Is that, as soon as the teeth start to appear, do brush them and make sure the mouth is clean before the child goes to sleep. It is quite important. Rather than just having them drop off to sleep while drinking milk, because then the saliva is not entering the mouth to the same degree after they've finished consuming food. So I think, but the most important thing is probably to stay away from sugary drinks. There's no reason to introduce that sort of drink at all for young children. But also we need to look at the ultra processed foods, and that actually, if you can just cook the vegetables and the meats and, even just use some bone broth once the kids get old enough, and try and feed a child. By the time a child's 1, they should be able to sit at a table and eat the same meal that their parents are eating. Yeah. I mean, no, and I sort of found that easier than sort of doing separate meals for the family, obviously, until the kids were a year old. I just there's the casserole that I'm making for my own family, and then there's the one without added salt or whatnot for, whichever baby it was at the time. And that was in a wee casserole dish, that would just go into the oven at the same time. But and then it would be just like mashed up, and consumed by that child, commensurate with her level of tooth and jaw and physical development by which she could do that. But they were both essentially, chewing through lamb chops like the rest of us, by the time they hit their first birthdays. Yeah.
You mentioned, which is a really, I would love your insights on the importance of saliva. Now, you're talking about oral health. Now, can you explain a little bit, if you're eating ultra-processed foods and drinking sugary drinks, what's the quality of the baby's saliva like?
Less than optimal, because we know that in your saliva you've got certain minerals like your calcium and your phosphorus, and there's a little bit of naturally occurring fluoride in there as well too. And so that's just like a natural mitigation system to actually help physically clear the products of food out from around your teeth, but it actually remineralizes your teeth in between eating episodes. And so, we know that calcium and phosphate, if you have that, this is why dairy products are associated with protection against decay, because, it's a good source of calcium, it's a good source of phosphorus that helps to enable a healthy and diverse oral biome as well too. But the saliva has got, fluid, other ions, that sort of thing. So the importance of saliva isn't actually in the remineralization of your teeth, to ensure that keep the enamel intact, because what we know is that after if you say have, I don't know, a biscuit or something like that, and you've got these particular bacteria that produce acids as a result of metabolizing those carbohydrates, and then so it drops the pH of the mouth environment down to below a critical level of 5.5, which is what you need for dissolving the enamel or for damaging the enamel of the tooth or demineralization of it. And so, and if you keep doing that often enough, if you just keep feeding yourself with these processed carbohydrates and drinks over time, and not having, and it's the frequency of consumption that's really important here. And so the saliva is actually a natural remineralizer of your teeth.
Now,
so it's a combination of salivary flow, and we do know that actually there are certain groups of people who have a greater caries burdens, like people with autoimmune diseases like Sjogren's syndrome, because of the interruptions of salivary flow into the mouth. Also, some endurance athletes have pretty appalling oral health because they're doing a lot of they might be mouth breathing, but they're having sugary drinks, like marathon runners, for instance. Having lots of sugary drinks, but there's not often a lot of water going down or chasing that away as well too. But teeth aren't being cleaned, and if there's interruptions in salivary flow, that does have a negative impact on oral health as well.
Now, one of the visions that I can see, the parent takes their 4-year-old or preschooler to the dentist, and then the dentist applies metal fillings.
Yeah.
What's your experience and knowledge on that space, the impact of you're putting metal into your mouth?
Well, I mean, it's not ideal, is it? Obviously the cavity has to be filled. They're trying to, it's an attempt to retain the tooth. I mean, I don't know enough about the impact of having the tooth filled. You'd hope it would come accompanied with some messaging around diet and that sort of thing. But there seems to be quite a reluctance, and it's actually really difficult for dental professionals to raise issues with diet. And that was one of the things that came through in some qualitative research, is that I interviewed health professionals around what makes it difficult for you to, prescribe dietary advice on the basis of what you believe and know about health. And the majority of them mentioned, the negative patient interactions. And actually, with dentists in New Zealand, they did a survey last year on the mental health of dental professionals. And, 69% of them are affected by negative feedback. There's 65 of them are nervous and anxious and on edge. And across the board, there's a high level of reporting of negative patient interactions, because what happens is they try and suggest something, the patient takes it badly, and then sort of, gets defensive because they feel like they're being judged. And the health professional or the dental professional never ever went into dentistry to try and make people feel bad. They went into the health professions because they want to help people. Everyone just feels bad. And so, there's possibly got to be other ways, because what's happened is we've had this whole cycle over the last 100 or so years of the doctor being the expert. And people to go to the health professional, they get told what to do or told what they're doing wrong, and then people go and try and do that. That's been, and that's a model of health that's worked quite well for sorting out infectious disease. Or if you cut yourself while doing your gardening, you can go to the doctor, you get stitched up, off you go, and your problem's fixed. But it's not a system that works for chronic disease or for even addressing the behaviours leading to that. And so, that's clearly not working. And probably another way is sort of going, well, okay, and just sort of talking to people more about, okay, what do you know about nutrition? What are your ideas about it? But also, what's stopping you from eating as healthily as you might want to, given what you know? And, reorientating that interaction. That's a line of work that I'm really interested in pursuing a little bit more. And I've been doing that in New Zealand prior to leaving. We sort of did some seminars in Central North Island. And, when it came to the discussion about, interacting with patients around nutrition, that's the part that actually got the most debate and the most engagement in that whole session.
That's a massive area of how to communicate the message over. I mean, if I had $1 for everybody when I ask, are you healthy? And they say, yeah, 100% I'm healthy. And you look into their larder or their fridge and you see ultra-processed foods, breakfast cereals, and you're not healthy. You can see in their face, the line, the communication is kind of lost a little bit. And I like what you're trying to do by, nobody likes going to the dentist, for God's sake.
No, right? No.
But the dental practitioner might not have the skills in their kit bag to communicate well. Their mannerism, they're doing a terrific job.
Yeah.
Don't blame the pigeon carrier or whatever the phrase is. They have to learn, and it's a tough one.
It's so polarized, and particularly when the burdens of poor oral health are most often borne in New Zealand and elsewhere by the people who can least afford. So there's all sorts of challenges and there's all sorts of barriers to eating healthily, but those people are often feeling just judged by what somebody's telling them. They think they're eating healthily because, quite frankly, if you go and look at any of the New Zealand dietary guidelines on how to feed your children to make them fit and strong, they actually have they actually endorse an eating pattern of a high frequency consumption of the foods that are implicated and associated with poor oral health.
I want to return to that bit about frequency of eating.
Yeah.
When I was a child, it was 3 meals a day. That was it.
Yeah.
Breakfast, lunch, dinner. And even at that, we have seen an explosion in the last 20 years. For example, in Australia, in the last 20 years, not only has the food been of poor quality or food-like products, but the dinner plate has grown in size. So we still have a stupid mentality of fill your plate up.
But the size of the plate is really huge.
Correct. Now, the
Yeah.
frequency of eating, we're doing things like having breakfast at 8 o'clock in the morning, and then morning tea. And if you've got children at school, you've got
Yeah.
snack break. When did snack break become part of modern society?
Well, actually, at some primary schools, they have a brain break, and then you have morning tea, and then you have lunch, and then it's like a 1 hour left to 2 hours left to school, and then you go home. It's quite crazy, actually. Yeah, because during school holidays, when this is going back to this sounds very much like, well, back in my day we did this, but actually I grew up in South Canterbury, so smack bang in the central of the South Island, in a very, very rurally isolated spot. Like I went to a school where there'd be like 25 kids total. It was all in one classroom. Yeah, so really tiny, very, very remote. But my cousins would come visit from Auckland, and so the boys and us we'd just go out for hours, and we were told to come back when the street lights came on, you know. But no one was running around after us with a breadstick saying you're going to collapse if you don't eat anything or anything like that. And we wouldn't have gone home because, quite frankly, we were having too much fun, and some of the things we got up to, it's it's a real very rural stuff. Like we would go to the local landfill and we would shoot possums, which sounds dreadful, but that's kind of what we did. And, and that wasn't unusual to do that sort of stuff. But no one sort of went chasing after us. And so when you go away on school, when we went on school holidays, and you didn't have that sort of structure of the day, we basically got too busy making our own fun. And you're not snacking. But the interesting thing that we tried as a family during the level 4 lockdown in New Zealand, which was sort of over March, April 2020, it was quite a severe lockdown. The only things open were the supermarket, petrol stations, I think. But essentially, we were pretty much stuck at home. But my children they were 16 and 14 at the time. And so they'd get up. No one really felt like breakfast first thing in the morning. So I sort of thought, well, let's do family brunch and get together and make it a bit social. And it worked really, really well because the kids always felt like they didn't really want to eat breakfast before they went to school, but they'd have to anyway because it was just like, oh, when are you going to have the opportunity? And you can't just sit down and have bacon and eggs through that morning break at school. And then they'd do more classes. They were kind of done with the school day by about 1:30, 2 o'clock in the afternoon. So therefore, their time was their own to go and, do a yoga workout that they'd seen on YouTube, or go and play music, or go for the walk or the run that you might be allowed to do. But you sort of realize how much the school day, actually probably how much the working day actually interferes with how we possibly should be eating as human beings.
But also, it's created this growth of snack foods to accommodate this,
Yeah.
which again is
Yeah.
another category of ultra processed foods.
Yeah, totally. And so, you look at the size of the lunchbox that these kids are going off to school with these days, and they're truncheons. They're like, you'd use this thing as a weapon. Whereas I think for me, it was, for us when we were going to school, it was probably this big, and there might have been one sandwich in it. But for me, there was like a boiled egg and an apple or whatever bit of fruit was, seasonal at the time. But it wasn't just the chips or the cookies or crisps, or I think you call them crisps over there, don't you? All those sorts of foods. And, and actually that primary school I was talking to you about, well, it actually had this fireplace with a grill on the top. And so you could bring along your toasted sandwiches or your casserole on a little tin plate from the night before and eat that for lunch. It was kind of like, it sounds really idyllic, actually. But it was probably a really great way for a kid to go to school and eat.
Sarah, I'm
And
just having these visions of Anne of Green Gables, actually, the kind of school that we went to in the countryside and the little hat on, etc.
well,
That's
you're probably not far wrong. There's one of the school photos from that time. It was after I was too old, but my youngest sister was still there when it snowed, and their school photo got taken, with the 3 rows of seats. And some kids standing up, some sitting down, but they're all sitting in gumboots, or what you call Wellingtons, I guess. because in amongst the snow with the mountain in the background and snow on the trees, it sort of looked like something out of fairy
Wow.
tale or something like that. It's so cool. I'll send you the photo
That
later
sounds
on.
good. Now
Yeah,
back to the main conversation around oral health.
yeah,
And one of the downsides is that when we look at health in general, we break it down into oral health. So you go and see the dentist. If there's something wrong, you
yeah.
go and see a doctor. And you mentioned it earlier that you break an arm or you're in a car accident, the good emergency services. Why are we not looking at it holistic health?
That is one of the biggest problems that exist today in the healthcare system, is that I hate using the word silos, but it's probably the best way to describe it. Is we've got dentistry here, you've got medicine here, you've got nutrition here, you've got behavioral science over here, and none of them really talk to each other. And that begins when doctors and dentists and nutritionists start training. There's no real integration. Now, I interviewed some GPs as part of the investigating what their understanding was about oral health, and sort of go, well, that's dealt with by dentists. But the only time they would see anybody with a dental health related issue, or any child with a dental health related issue, would be for the prophylactic prescription of antibiotics prior to a child going into surgery to get multiple teeth removed. But even when a child presents with sore throat, and the doctor opens up the mouth and has a look at the throat and everything like that, if they notice a dental problem, it's not noted or anything like that. It's dealt with completely separately. But I just sort of think, gosh, it's the earliest manifestation of metabolic disease. And it's occurring so early in the life course, whereas we sort of regard metabolic disease as, where, someone's got a diagnosis of type 2 diabetes, or they have non-alcoholic fatty liver disease, and that's presenting with greater frequency in adolescents these days. And that's something that didn't even exist prior to 1980 in any particular numbers. But that's an increasing problem, and that's like the liver doing a very silent scream before anyone's ever returned a positive or an adverse HbA1c test. Whereas dental caries, unlike all those other things I'm just describing, is presenting in children. And so the state of the mouth health is the canary in the coal mine, or a very loud alarm bell, you would think, because it's painful,
It's
for poor metabolic health.
it's funny. There's a terrific amount of work happening in the US with Dr. Dale Breston in the Breston Protocol, and
Yeah.
it's a 36-step protocol, and it's either 3 or 6 of them are focused on dental hygiene and the
Dental
correlation
hygiene.
between that and Alzheimer's and cognitive decline.
Yeah. Well, we
It's
know that
fascinating.
periodontal disease sort of often goes hand in hand with type 2 diabetes.
Yep.
And it's a systemic inflammatory disease, characterized by, the receding of gums away from the tooth. And it's a very frequent cause of tooth loss in older people, particularly those with diabetes. So, of course, they lose their teeth, they can't chew meat. The whole cycle continues in the same way that it does for the toddlers that we've just described. They've got sore mouths, but these people have lost their tooth. But they've got gum disease as well, too. And, so that presents with higher, adverse inflammatory markers as well too. And so, which is how that gets linked to, and because of the adverse oral biome. So there's this idea that, there's all this bacteria, and there's cardiovascular disease going on, and there's periodontal disease going on. But it could be that there's just a multiple cause of just systemic inflammation, because we know that there's a systemic inflammation element behind dental caries as well too, rather than it just being a within the mouth response as well. And that's the thing that links dental caries to poor metabolic health as well. and that's, you sort of think, I've talked to a dentist who said that she had no idea about that at all. And so we've got all these, it's integrally related to metabolic health, but it's not treated as such, even though it's treated within the health system at huge cost to the health system.
It is a massive cost. The numbers that you said earlier in this podcast are astronomical. And that's only one area of poor dental care.
Yeah, poor dental
In
health.
essence, we are, if we take it particularly on childhood, we are killing our kids with ultra-processed foods and poor oral health on a pathway that if you've got poor oral health as a young child, there's a high likelihood that you will have poor metabolic well-being as you go through life.
Because there's been an established snacking behaviour that's associated with increased obesity or presentation as overweight. And so there's because of that eating pattern that's been established early on that's associated with, the, increased caries burdens, well, often, that's not fixed. And so what we know that, the kids who are getting the preschoolers who are getting their teeth taken out when they're very young, as in preschool age, they're often underweight because they haven't had a nutritionally replete diet. They're nutrient deficient in lots of ways. But by the time these kids get to early to mid-adolescence, they are more likely to present, the kids presenting with caries are also more likely to present as overweight, at the very least.
So another angle I want to talk to you about, and I don't know if it was part of your research, is the correlation between oral health and mental health.
Right, yep.
If you've got poor oral health, does that have an impact? We've mentioned there that it's going to have an impact on your metabolic health. But is oral health a pathway for anxiety, depression, cognitive inability to learn?
Well, I think we know that, the the high and frequent intake of ultra processed foods are involved with poor mental health, and that's through a range of elements that are multi-directional, because you're not wanting to exercise as much. It's having an impact on your sleep as well too, particularly if you're eating these things in the evening. So that's sort of how these foods have an impact on both your oral health, but also on your mental health as well too. But if you've got poor oral health and you're self-conscious about your teeth, and you're worried that they'll smell or if your mouth is hurting, it has an impact on your ability to participate in society. If you've got a whole row of black teeth, that's going to be detrimental for self-confidence, your self-esteem at school. It has an impact on your language development, and your other speech development, because maybe just, moving your jaw hurts. I don't know what that feels like, but we do know that that's a factor. And that if you've got poor oral health, you're going to actually, and if there's pain associated with it, or you're self-conscious about how your mouth looks, it affects your ability to smile. The first thing that you and I did when our faces appeared on this video call today is we smiled at each other, probably before we said hello. And I can remember being at a conference a while back where there were some issues with something at the start, and I was just sort of standing up there, and I was just like, oh, well, talk amongst yourselves. And the first thing these people did, and I pointed this out in the talk, it just became a part of the talk, is that first thing you did is you turned around, you looked at the person sitting next to you, and you smiled and started talking to them. So this is why this is actually really important. And so anything that's going to interfere with your ability to engage with others in society or work or learn to talk is going to be detrimental. Because of the impact on self-esteem and self-confidence.
It's fascinating that now as adults we spend an awful lot of time, and a lot of people spend a lot of resources on getting veneers, getting, here in Europe, going to Turkey, in Australia, going to Bali or going to Thailand to get their mouth seen to, and it costs a lot of money.
Yeah. It probably comes with some risks as well too.
Again, if I had a dollar for people who have thrown money at things and not understanding the risks involved,
Yeah.
as soon as you start interfering, you're interfering with your metabolic system within your body.
Mm.
But let me ask you, really simple question. We talked there about ultra processed foods, and you mentioned it in your talk there about brushing your teeth. Is there evidence between the types of brushing that you can have between, say electric brushing and non-electric toothbrushes?
Yeah, it's interesting because, in societies, over hundreds of years, they didn't brush their teeth. And there was a remarkable lack of tooth decay, despite Lumino, the dentist, not being established in or rural outposts or anything like that. There's some evidence, depending on which way you look at it, that actually we probably need to brush our teeth these days just to get rid of the teeth. But actually, it's recommended we use softer toothbrushes because you don't want to create enamel damage that might already be going on because of the intake of foods. And so, hard brushing with hard bristles, or applying too much pressure, well, that can damage enamel. But I mean, that sort of goes to another issue that I think you said before that we wanted to raise about, we've got acid in the mouth appears through a range of reasons that causes, demineralization of the enamel. But it's the high sugar or the high refined or high frequency of refined sugars diet that contributes to the decay. Because, for instance, the eating disorder bulimia is often diagnosed by a dentist because of the type of pattern of enamel erosion that's associated with the regurgitation and purging that occurs with that particular eating disorder. But so, I mean, as far as brushing goes, I haven't looked at the evidence for, electric toothbrushes versus just normal brushing. But, you can sort of see how if you're brushing really hard or with, that sort of forced brushing of the teeth. I mean, but enamel is the hardest substance in the human body. I mean, it's been built to withstand quite a lot because we chew things, we get you might get hit in the face or something like that if you hang out with the wrong people or whatever. But there's a lot that, I mean, enamel's the hardest surface in the human body. Dentin is the second hardest. And so your teeth have been built to withstand quite a lot, whether it's the forces or chewing food or, helping to keep jaw in shape. Because you sort of see what happens when people do have a lot of teeth removed is that the shape of the jaw just completely collapses. And so, your teeth are quite tough and they're built to be tough. And we've got some mechanisms, like your saliva, for keeping them healthy. Yeah.
Now,
That was sort of a very roundabout answer.
it was, but
The whole
it's actually
toothbrushing
great.
thing.
It's a great segue, Sarah. If you had a crystal ball, what would oral education look like and feel like?
There'd be far more focus on prevention via dietary means than on the remedial practices to fix them. I mean, we need these remedial practices. I mean, if you've had your mouth smashed up in a car accident or something like that, you need some very clever people to repair that. But given the sheer burden of dental decay and the sheer burden of oral health problems in which poor quality diet is implicated, that needs to be stronger, it has to be emphasized more strongly in dental education. So that would be one of the other things. And there to be more integration with nutrition education, whatever that looks like, but also medicine, but also behavior change, so that we can actually make some inroads on that. And actually improve the experience of health professionals providing advice for prevention. Because, it's really tough listening to dental professionals discussing how hard patient interactions are and that they tend to get quite fraught and people feel judged and victimized and around, you know, eating habits, and they'll look at a dental professional and go, well, you've got no idea what my life is like, and all the rest of it, because, you know, they'll perceive a dental professional as being quite a well-paid person, and able to afford good food. You know, that's one of the things that comes out of it, and the dental professionals sort of sitting there going, well, I know that. Yeah, and it gets quite fraught. And so, you know, ways of improving that experience, just so that we can retain all these people in the health force, would be a really good thing. I've taken some notes because you did send that through. But I think that recognition that changes to population health actually require changes at multiple levels of society, and that involves, and dentists are in a position to advocate for this, by the way, involving changes at multiple levels, whether it's, you know, getting some control around the advertising of harmful foods. We've done it for smoking, we've done it for alcohol use. We probably need to have something like that for ultra-processed foods. And I'll give you an example where how in New Zealand that this just went sadly awry during the pandemic, when you know, during a current affairs show screening at 7 p.m, there was, you know, they invited viewers to send in videos of their families having fun time in isolation. You know, whether it's physical activities they did together, or, you know, backyard games or whatever. And the best video of the day got rewarded with Pizza Hut vouchers. And so you've got a competition that's sponsored by a processed food company, and they're doling out vouchers so that when the lockdown ends, you can hop off and go to a fast food outlet. And so, of course, when that lockdown was over and the fast food outlets got opened up again, it was the lead item on the news, was all these people going off for fast food. But the ironic thing is they're having to queue for hours just to get their fast food. And so you could have just gone to the butcher, got a steak and got all those things that you might have wanted to have a hamburger with, if that's the thing you wanted. But they all wanted to go and get McDonald's again. And you've got this sort of advertising being allowed. And there was a researcher at University of Auckland called Fee Singh, and she's doing a doctorate on, you know, the marketing of all these foods in part. And she said that, you know, we've got an advertising standards authority that is just pretty spineless, really, because it's run by industry figures as well, you know, with regard to advertising standards. And it doesn't actually meet any sort of public health law requirements as set out by the World Health Organization around the marketing of unhealthy food to children in New Zealand. So we've got problems like that. So there's recognition that we actually, rather than just telling people what to do, recognizing that there are problems at national levels, global levels, community levels, what we have at the supermarket, the vending machines that are public facilities, and, you know, right across the board. And I think, you know, dentists and other health professionals are in a position to advocate for changes in this area. That was another very long answer. Sorry.
Funny, Sarah,
Yeah.
actually, just listening to that, it's very much oral health is a bit on par with type 2 diabetes. It's
Yes.
not sexy enough to be advertised.
No.
Right?
No.
Now, if you've got poor oral health and you've got type 2 diabetes, you're shortening your lifespan, your health span, by 15 to 20 years, at least.
And you've often had the poor oral health long before you've been diagnosed with type 2 diabetes. Because we know from the world famous Dunedin study that most new dental caries actually occurs in adults. But the dental system in New Zealand is such that after the age of 18, your dental health is looked after by the private market. You know, you actually, it's not publicly funded unless you have a community services card, which means that you're of a low income or you're a member of a particular vulnerable group, by which you get your dental health taken care of for a minimum cost. But that's relatively few people in New Zealand. But most new caries occurs in adults, although the prevention element is geared towards kids, because there's this idea that if people get their kids eating healthily, well, then everyone will eat healthily and have good oral health. But it's not, but the focus of prevention is actually oral hygiene strategies and doing things like going and getting dental checkups and brushing your teeth and flossing your teeth and eating a healthy diet. And then when you go and look at the New Zealand Dental Association website, they refer you to government endorsed health promotion pages, which have all the recommendations that fly in the face of the evidence regarding poor oral health.
It's astonishing, actually, and you've given me another reason to get my book out there, Keto for Kids, and encouraging
Right.
kids to
Yeah.
help teach their parents, instead of the desire, I want to go to McDonald's, I want to go to the butcher.
Yeah.
Right?
Yeah. But
I
it's
want
just
to eat,
not.
I want to eat a carrot because when you slice a carrot, it looks like the iris in your eye. I want my eyes to look good. And
Yeah.
just simple
I
little
think,
tools that are
yeah.
easily done. But nobody,
Yeah.
no, I was going to say, nobody cares about your health, but they do care if you've got the latest iPhone or the latest laptop,
Mm,
right? And
yeah.
again, that's this cognitive dissonance around what health actually is.
Or what it looks like and what it feels like
What
for
it
people.
feels
And
like.
with and what I think with with families, I mean, it's hard because the food environment out there, like, and I've just, my youngest child's just left home and to go to university now. But through that, I think the best thing you can do is have some fairly tight controls on what you have in your fridge mainly at home, and it should be all in your fridge, or the majority of your food should be in your fridge rather than in your pantry, because it's fresh and better for you than things that are overly shelf stable, like ultra processed food. So we go for the full fridge empty pantry mantra is quite useful. Another focus to take is, okay, if you're looking at what you do the majority of the time is what's important. We live in a society, we socialize with other people, we um, go to sports events. Things might go off the reservation a little bit, but what you do the majority of the time is likely to be the most important. But when your kids are growing up, until they get to that age where they start earning their own money, and whether that's by delivering pamphlets to mailboxes when they turn 10 or 11 and that sort of thing, once that starts happening and you get the influence of their peers. Now, for instance, I could go and take my daughters to netball on a cold Saturday afternoon in the central North Island, and it's going to be freezing cold. And I could bring along, and I've done this several times, nice hot thermos of homemade soup, carrot and cashew nut. And I know that everyone loves it, right? The kids, my daughters really like it. I might be standing there with this pulled out. The one and only tuck shop up there is selling spring rolls and hot chips and all the rest of it. And two of the teammates come back with their spring rolls, hot chips, and say, "Oh, do you want to share these?" And of course, my daughter isn't going to say, "Oh no, I'm going to have carrot and cashew nut soup." They're going to pitch in because eating is social, and it should be social. Civilizations through history have eaten together and grown and stayed together and functioned well, and got tighter because of rituals like eating together. And so that's what's sort of playing out. And so you sort of think, well, that's me, having my soup by myself, while everyone's just finished their game. They're all happy. They're running around with their mates. And so that sort of stuff was going to happen. And I try not, you don't want people to sort of parents to go beating themselves up about that sort of occasion, because there's all sorts of other good things that are happening because of those nice social interactions. It's nice that people want to share food with my daughters, for instance, and hang out with them, and they're nice friendships. But as long as that sort of thing isn't happening the majority of the time, that they're not eating hot chips or pizzas, but the food environment that we live in and other people within that, like, my kids were at a primary school where parents might bring in a birthday cake, because it's their kid's birthday, and a birthday cake to share with a class. And of course, that got a bit fraught because, you've got a child with type 1 diabetes in the room, and you've got another child like mine who had celiac gluten sensitivity. And so someone will advise you to do that. And then I feel like I have to then, I'm under pressure to go and bring some cakey type snack for her because it's some other kid's birthday, which is just weird. So there's all those sorts of things that are happening outside families and, food environments. So I think most parents are trying to do the right thing by their kids. And in the research that I did with semi-structured interviews of parents is that they're all trying to do their best, but there's all sorts of conflicting messages about what's good. Eggs are good 1 week, steak's good 1 week. No, hang on, meat's causing cancer. The eggs are going to raise your cholesterol. We should all be eating plant-based foods, and that's because meat's not only going to cause cancer, but it's bad for the planet. And so there's all this welter of conflicting messages, and even some of the doctors are saying, well, actually, I'm confused myself. But their problem is that they've got all these people in the community who expect them to be experts on nutrition. And they're sort of going, yeah, we only got about 10 hours of this in our entire medical school education. We're not experts on nutrition, really. But everyone expects them to be. So there's that disconnect as well. So for family eating, it is fraught and it's difficult. But I think you just think of progress, not perfection, is really good because of the food environment that we've got. But for the stuff that you can control, set some rules around that, around what you're going to have in your fridge or not.
Yeah. Sarah, you've got so many nuggets, and that's real nuggets, not the ones out the fast food store, of fantastic information. How did people contact you to learn more about your work and what you're doing in this space? Because it's fascinating.
I'll send you my Twitter and Instagram handles, I think they're called. So people can contact me through Twitter or Instagram or Facebook should they want to do so. I'll send those through to you so you can put them at the bottom of the show notes.
That would be great.
Yeah.
Sarah, it's been an absolute pleasure finding out so much about the Kiwi land. It's been a pleasure hearing your dulcet tones. And I can't thank you enough, because you're giving some great insights on an area of metabolic health that is forgotten about in that of your mouth.
Yeah.
So
and especially that systemic thing with, the whole fact that, when we eat all these refined sugars frequently, you're going to, that's increasing the metabolism of the mitochondria of your hypothalamus, and then you've got the hypersecretion of, the oversecretion of insulin, but you get that downregulation of parotid hormone release that controls that dental fluid flow by which your teeth get nourished. And so, which is how the decay really occurs, because you've got a malnourished tooth as well as the acid attack on the enamel. There's all those sorts of elements that just are neglected as far as that goes. But, that's the evidence that ties the poor oral health and the poor metabolic health together. That's a different but the same, same mechanism. Inflammation is the root cause of it.
Right, I'm going to get you on for another podcast because there's so much goodness here. But we're going to have to stop this one now because there's so many words. Stay on the line. I'm just going to end this recording just now. Thank you.
Okay.